Welcome. I want you to meet Mike. Mike is a middle-aged male that's presenting to your clinic with some primary anterior shoulder pain. Described kind of this tight ache that's 0 to 2 out of 10 at rest that does increase to a 6 to 7 out of 10 as it gets worse. In addition to some anterior shoulder pain, he also notes on his intake questionnaire that he's got some general achiness into kind of the lateral elbow, relatively achy, usually brought on after some of the shoulder pain. Only gets up to about a 2, but for the most part, doesn't have a lot of pain at rest, only when that shoulder is a little bit elevated. Upon further examination, he's a 48-year-old male. He's had left shoulder pain from an injury about 5 weeks ago. He was referred to you from his primary care provider with a diagnosis of impingement syndrome. His injury occurred after pushing a stove up into a truck about shoulder height. He felt a twinge and some immediate pain. Let it go to see if it get better, but overall it's still less painful, but still weak. Biggest thing, is his anterior shoulder pain that does radiate into the elbow. He does feel overall overhead weak and tight with some motions. He's waking at least 2 to 3 times a night due to positioning. And really, like I said, he has minimal pain at rest, but definitely associated with increased work activities, these symptoms do increase. He does own his own construction business and is still very active. His primary questions after his subjective reports was, what else can he do? Does he need to see an ortho MD? He needs to get back to full work. He's had a friend that's had a rotator cuff tear, wants to make sure that he doesn't need surgery. If he does need surgery, he needs to get it taken care of at a certain point in time, just because of his self-employment at work. So after he kind of gives that initial story of what happened, how things are affecting him, what further clarifying questions would you like to hear from Mike?